what do you see the future of this role being?
The future, wow. So reflecting back, I've been a clinical nurse specialist for 15 years and was moving along just like everybody else up until COVID hit. And I know COVID impacted everyone in a different way, and I'm no different. My home life, it was affected. But in my professional life, as far as it relates to the clinical nurse specialist, that's where I began to see the future. Because where we were able to shine was that versatility in our role, the way that we bridged and the needs that the organizations had, the nurses had, that and the patients, we stepped right in with total comfort because that's what we do. And while a lot of other professions were shifting and pivoting and trying to adjust, a lot of the clinical nurse specialists that I work with, they felt total comfort in just coming in that, yeah, this is what we do. We're going to figure it out. We solve the problem. There's massive change that needs to happen in the hospital. We don't have all the answers, and that's okay. But we're going to bridge, and we're going to go one step at a time, and we're going to figure this out. And so to me, that's where the future is, because I think we can all agree we're not going back to whatever the world was before the pandemic. There's a new normal now, and we all know it. And so that also gives us a little bit, as people, just uncertainty, and that makes us uneasy. But I do think that's where the CNS and the future of the CNS can shine. If we really, as CNSs, can show, we really need to show our impact on how we truly make a difference in those nurses that we're working with, or at the system level. How many dollars did we save? How many patient complications did we prevent? That is really where the future begins to emerge, because that is what we're doing, but we're oftentimes so busy doing it, we don't stop and say, let me write it down and make sure everybody's aware. We don't do enough of that, not nearly enough. But to me, there's going to be tremendous opportunity with the advent of AI and all of the changes that is impacting healthcare and helping us diagnose earlier and helping us to be more efficient in the various work that nurses do. This is a place where CNSs can step in. We first need to fully understand it like everybody else, but then we also can start bridging to the nurses, how it can help them, bridging to the companies that the hospitals interface with. How can we improve patient outcomes in the hospitals? This to me is the future. And so the future is more of what we did during the pandemic, but also capturing it so that we tell everybody else along the way.